The pancreas. So the two main hormones are insulin and glucagon. The hormone secreting cells of the pancreas are called the islets of Langerhans. So the alpha cells secrete glucagon and the beta cells secrete insulin. So let's talk about insulin. Insulin is released in response to increased blood levels of glucose as occurs after a meal. Insulin helps to transport glucose into most cells. So without insulin, glucose remains outside the cells, thereby depriving the cell of its fuel. Insulin is the only hormone that lowers blood glucose. Insulin helps control carb, protein, and fat metabolism in the cell. Insulin stimulates the breakdown of glucose, called glycolysis, for energy, and stimulates the liver and skeletal muscles to store excess glucose as glycogen, called glycogenesis. Insulin increases the transport of amino acids into cells and then stimulates the synthesis of protein from the amino acids. So if insulin receptors are damaged, they cannot respond to the insulin and the person becomes hyperglycemic. The hyperglycemia then triggers the release of additional insulin and the person becomes hyperinsulinic. If there are a diminished number of receptors, the number of insulin receptors on the membrane can increase or decrease. So obesity and lack of exercise can cause the number of insulin receptors to decrease. This means that obese people can secrete plenty of insulin, but their cells cannot respond to that insulin. Some cytokines antagonize insulin, causing them to have a state of insulin resistance. A strong link exists amongst insulin resistance, obesity, and diabetes. A new term, metabolic syndrome, addresses this issue. So in your Do You Know box, it says that diabetics are often hyperglycemic in the early morning hours at dawn, despite insulin therapy and lack of food intake during the night. So why is this? So throughout the night, the person secretes growth hormone, which stimulates glucogenesis and increases blood glucose. Now let's talk about glucagon. Its primary action is to increase blood glucose levels. And it does this in two ways. Number one, by stimulating the conversion of glycogen to glucose in the liver. And number two, by stimulating the conversion of proteins into glucose, called glucogenesis. So the stimulus for the release of glucagon is a decreased blood level of glucose. Did you know? If too much insulin is taken, the blood glucose levels become too low, causing hypoglycemia. The hypoglycemia, in turn, stimulates the secretion of glucose, elevating hormones such as glucagon, cortisol, growth hormone, and epinephrine, causing hyperglycemia. So this Somogyi effect is a rebound phenomenon in which hypoglycemia is followed by hyperglycemia, and they are a result of the hormonal overreaction to low blood sugar levels. So let's rethink. What are the two pancreatic hormones? Insulin and glucagon. Number two, what is the stimulus for the secretion of each pancreatic hormone? The stimulus for insulin is an increase in blood glucose levels, and the stimulus for glucagon is a decrease in blood glucose levels. Number three, what is the only hormone that lowers blood glucose? Insulin is the only hormone that lowers blood glucose.